In this video, we'll see the continuation of the physiological changes in pregnancy, part 3. In the previous video, we have seen about the physiological changes, which include hematological changes, biochemical changes and metabolic changes. In this video, we will see the remaining changes seen in pregnancy. First, coming to the systemic changes, of which first let's see about the CVS, cardiovascular system. In cardiovascular system, the apex beat or the apical impulse is shifted to the fourth intercostal space it is shifted outwards and to the left by 3 centimeters. This is seen in third trimester of pregnancy. So this is because of the enlarging uterus, which displaces the heart upwards. So this is the change in the apex beat. Next, also there is increase in the cardiac volume, that is the cardiac output increases. Also the end diastolic volume increases. End diastolic volume is nothing but the preload. Coming to the heart sounds, there is loud first heart sound, and the third heart sound is heard in 75% of the pregnant women. This is physiological. Then there can also be systolic ejection murmur, and the ECG findings, there can be a prominent S wave in lead 1 of ECG, and there can also be P wave inversion in lead 3. Coming to the pulse rate, there is increase in pulse rate by about 10 beats per minute. Then the cardiac output increases to about 5.5 liters around the 12th to 16th weeks. It further increases to around 6 liters per minute by the mid pregnancy and remains so throughout the pregnancy. And at term, the cardiac output starts to decline to about 5 to 5.5 liters per minute. This is cardiac output. Next is the blood pressure. The blood pressure normally is between 110 millimeters of mercury and 120 millimeters of mercury systolic, and the diastolic ranges between 75 to 85 millimeters of mercury. This is the diastolic blood pressure. Next, the other changes. There is increased tendency for varicose veins. This is because of the venous pressure changes, especially in the femoral and other leg veins. The pressure increases. These are the changes seen in the cardiovascular system. Next, coming to the respiratory system. In the respiratory system, the subcostal angle increases and the diaphragm is raised by about 4 centimeter, and the respiration becomes more diaphragmatic. This is all because of the enlarging uterus. But the important thing to note here is the vital capacity of the lungs remains the same. There is no change. Then there can be physiological dyspnea. Due to progesterone by its direct action on the respiratory center. This leads to the physiological dyspnea. The next system we'll see about is the gastrointestinal system. Most of the pregnant women, as we all know, present with nausea, vomiting, indigestion and constipation. Also, there is heartburn, which is common in pregnancy. This is because of the increased intragastric pressure and decreased intraesophageal pressure. And also the lower esophageal sphincter tone is relaxed. That is why this leads to gastroesophageal reflux disease, which in turn causes heartburn. And during labor, there is prolonged gastric emptying time, and this is a risk factor for aspiration during anesthesia. Next, hemorrhoids are also common due to increased venous pressure. Then the gallbladder contractions are also reduced, leading to bile stasis. Due to which there is increased risk of cholesterol stones in multiparous women. The next system we'll see is about the urinary system. In the urinary system, the size of the kidneys will increase, and then the smooth muscles of the ureter becomes relaxed. The ureteric smooth muscles relax, and then there is increase in the glomerular filtration rate and increase in the renal plasma flow, due to which there is decreased in serum urea and creatinine. And we can also see glycosuria, which is common in pregnancy. This is about the urinary system. Next, coming to the nervous system. In the nervous system, we can see temperamental changes, more common in the pregnant women, and also there can be melancholia and real psychosis can also develop. This is more common in people with family history. Also there can be postpartum blues or postpartum depression because of the maximal sleep disturbances. The next system is the endocrine system. There are many hormones which get altered during pregnancy. Some of them are, there is increase in the beta HCG levels, human chorionic gonadotrophin, which is synthesized by the syncytial trophoblast. Syncytial trophoblast cells secretes the human chorionic gonadotrophin. This is mainly luteotrophic, that is, it maintains the corpus luteum till the placenta takes over, that is till about 10th week. Next, there is also increase in estrogen. As we all know, pregnancy is a hyperestrogenic state which lasts until delivery, and in pregnancy the most common form is estriol, whereas in normal periods other than pregnancy, estradiol will be the most predominant form of estrogen. Next, the progesterone. The progesterone also increases, and this is the hormone which maintains pregnancy, as we all know. This is initially secreted by the corpus luteum, and subsequently after 10th week the placenta takes over the function and the placenta starts secreting progesterone. Next, the androgens. Androgens like testosterone and androstenedione these are found increased during pregnancy. Then the human placental lactogen. This is also known as human chorionic somatomamotropin. This is also produced by the syncytial trophoblast. This is responsible for the lipolysis and it inhibits gluconeogenesis. And this also has anti-insulin action. This is one of the main hormones responsible for the diabetogenic state during pregnancy. Next comes the prostaglandins. The most common prostaglandins are PGA2, PGE and PGF2. Then there is increase in pituitary hormones like the gonadotrophins, that is the maternal FSH and LH are increased. Then the ACTH levels are increased. There is increase in melanocyte stimulating hormone which is responsible for the skin pigmentation changes. Next, there is also increase in oxytocin. Oxytocin also increases during pregnancy, which stimulates the uterine contractions, and it also causes ejaculation of milk during lactation. Next, the adrenal hormones are also increased. Like corticosteroids, aldosterone, then there is slight increase in the size of thyroid gland due to hyperplasia and due to increased vascularity. So there is increase in thyroid binding globulin. Also there is slight increase in the thyroid hormones. Insulin. So pregnancy, as we all know, is an insulin resistant state. This is most commonly due to human placental lactogen and increased levels of corticosteroids. Next, the renin. Renin is also considerably raised during pregnancy. This is produced due to decreased mean blood pressure in kidneys or by ureteral obstruction due to gravid uterus, and there is reduced contraction of the body sodium. All these causes increase in renin secretion. Then the other changes we see during pregnancy include changes in the pelvis and the skeleton. Here there is increased vascularity in the pelvis and the ligaments become lax, and all the pelvic joints become tender and easily mobile. Next, coming to the skin changes. In skin changes, the abdominal wall becomes thinner and it gets distended. There are presence of stretch marks called as striae gravidarum, which are curved irregular lines which are mostly radially arranged over the abdomen and sometimes over the thighs. These are due to rupture of the subcuticular elastic fibers. So after delivery, this changes into linea albicans. So they become pearly white silvery lines after delivery called as linea albicans. Next, pigmentation. During pregnancy, there occurs dark patches on the face which are called as chloasma or they are also called as melasma. Melasma gravidarum, which are commonly known as the mask of pregnancy. Then there is appearance of linea nigra, which is nothing but there is a brownish line in the middle of the abdomen. This then turns black. This is called as linea nigra. The other pigmentation changes include angiomata, and palmar erythema. These can also be seen. So this is the entire thing about the changes in pregnancy, the physiological changes in the mother during pregnancy. Thank you.